As we celebrate Health Center Week and we celebrate the opening of this site, it's really important for us to hear the stories of the people impacted. So I have the great opportunity to invite up one of our patient board members, Karen Peffer, to share a few minutes of her story and why the Health Center has made an impact on her. Karen.
Good morning.
Good morning.
I'm excited to be here for the ribbon cutting at the Neighborhood Health Center's newest location. It's just a short walk from my home. I do want to say that my journey here actually started back in 2005. I was pregnant and in need of an OBGYN. I asked everyone I knew for recommendations. Excuse me, I'm known as a crier. The names that kept coming up, the more people I asked, were the doctors here at Neighborhood. One of my neighbors, who happened to be a labor and delivery nurse, said simply, anyone can deliver a baby, but the doctors at Neighborhood deliver babies and take care of the moms. I became a patient at that Long Avenue office. I got prenatal care and trust was earned. I'm happy to report that I was able to deliver a really healthy baby who is here today, now 20 years old. My husband was the stay-at-home parent, and my new employer did not offer family health insurance. So my husband had Healthy New York, and my kids, firstborn, had Child Health Plus. Both of those, in case you didn't know, were Medicaid products. Did you know that the health center movement was born from the 1964 War on Poverty? Because healthcare is a right, regardless of ability to pay. I loved being a mom. And I talked my husband into having another baby. It wasn't as easy the second time, I will tell you, and we struggled. I went for an infertility consult with my OBGYN at Neighborhood, and I actually found out I was pregnant at that appointment. She's still making appearances when she's ready. That pregnancy was very high risk. I ended up in the hospital for 51 days. Those 7+ weeks were undeniably hard on our little family. The kindness, compassion, and care we received, I absolutely, figuratively, and actually really saved our lives. Our daughter was born early. She needed time in the NICU to be able to breathe, suck, and swallow. But I'm happy to report that she's also here today. Recently graduated from high school and will be attending university later this month. So over these 21 years, Neighborhood has also become my primary care provider, the place I came for podiatry and counseling. I like to say that they take care of me from head to toe. And it's not just me, my husband and my kids are also patients here, and we, including our dogs, use the pharmacy. I came to Neighborhood for care, and we've stayed because of the quality of that care. We now have good paying jobs with health insurance. According to the Health Resources and Services Administration, the federally qualified health centers must meet a number of criteria, including serve an underserved area or population, provide comprehensive services, have an ongoing quality assurance program, and have a governing board of directors. As a patient board member, I am proud to be part of an organization that leads with kindness, builds resilience, succeeds through teamwork, and seeks fairness. Thank you for being here today.
So Karen, as you can tell, is a patient and a patient advocate, staunch advocate. As a board member, she will advocate for what is right and good for our patients, and more than willing to help me to see and our team to see where we can do an even better job. And that's part of how we have gained the success we have, is from patient board members and from hearing when people tell us how we do well, but more importantly, where we can do better. So. And Karen has been, she put her money where her mouth is. Her and her family made a donation to this location to make sure that we could open the doors. And so that's a full circle story. A family on Medicaid started with us, having jobs and the resources to be able to donate for our 7th site. That is what the health center movement is all about. So we will be having a plaque to commemorate the Peffer family in the waiting room here, which we will unveil. And
It's under there. It's under
it's
there.
under here. I knew I was supposed to find it. The Peffer family plaque will be posted in our waiting room. So that concludes our presentation. We will do a ribbon cutting out in front of the building. So we'd love everyone to come out and do that ribbon cutting with us. So I just want to thank you one more time, thank our team, and thank you all for coming this morning. Thank you our elected officials for your time and for understanding and supporting the important nature of the work we do. And we look forward to seeing you back for our 8th site. Thank you all.